ABG interpretation is one of frequently asked questions in NCLEX exam and in medical school OSCEs. Here we are going to follow the tic-tac-toe method for interpreting ABGs. Before starting, you need to know the normal reference ranges. The normal range for pH value ranging from 7.35 to 7.45. Anything below the reference range is called acidosis and above the reference range is alkalosis. Anything below 35 is basic and more than 45 is acidic. In bicarbonate, it is opposite. Anything below 22 is acidic and more than 26 is basic. Then we need to find the cause for abnormality. Whether is this due to respiratory cause or a metabolic cause. CO2 and bicarbonate levels are useful in finding the cause. The PaCO2 level represents the respiratory functions and bicarbonate level represents metabolic functions. Let's move into a question and start interpretation, as it's the one of best way of learning. This ABG is from a 62 years old lady in post-operative period. The pH value of this patient is 7.24. The normal pH is 7.35 to 7.45. So this is less than normal level and it make acid. Then check the carbon dioxide level. It is 52. The normal level is 35 to 45 and this is more than that, so it also make acid. Bicarbonate level is 32, the normal level is 22 to 26 and it makes a base. As there are 3 acids in a row, this is acidosis and patient has high CO2 level, which represent abnormality in respiratory functions. So this is respiratory acidosis. And now we need to check whether body is trying to compensate these abnormalities. His bicarbonate is more than normal level, so body is trying to increase the base level and trying to compensate, but the pH level is still less than normal level, so it is partially compensating. Just imagine if the bicarbonate level is within normal range, body is not trying to do anything to compensate this, so it considers as uncompensating acidosis. In our next video, we are in depth discuss about the compensatory mechanism and more questions. Thank you for watching. We will meet you in our next video. Until then, happy learning.